Hello guys, Assalamu alaikum. I hope you will be fine. My name is MD Mahabub Hussain. Today we will discuss skin cancer. What is basal cell carcinoma? Basal cell carcinoma is a type of cancer that affects the skin. It's the most common type of skin cancer and can also be referred to as basal cell cancer. Abbreviate BCC. Basal cells carcinoma may be recognized as a shiny, riced area of the skin which has blood vessels running through it. Fortunately, it's not unknown to causes death and does not, as usual, spread outside the infected zone. So, how does it operate? How does it operate? Is it contiguous? No. Basal cells carcinoma cannot be contracted from an infected person. Once you have it, it remains with you. Wait, not everyone is likely to incur its worth. Studies what reveal that people of the right reach are the most potential victims of basal cell carcinoma. If you have goat green, blue, or gray eyes, red or blonde hair, when you have got to which your skin for anything of it. Other likely victims are those who spend hours tanning in the sun. Prolonged exposure to arsenic poisoning and radiation is another way of acquiring this type of skin cancer. And last but not the least, having a weak immune system. Now to the question of what causes basal cell carcinoma. There are two main causal agents of basal cell carcinoma. The first began through a grim known as the follicular subcutaneous approaching grim or trichloblast, whereas the other is sunlight. However, the more scientific causes of the cancer is attributed to the sun, and this is because too much exposure to the sun causes a kind of damage to a person's DNA. This is known as thinning dimers, and this, when left to accumulate due to the body DNA repair not clearing it all out, cloud led to mutation, which in turn could result in the birth of basal cell carcinoma. Moreover, overexposure to the sun tends to weaken the immune system, 3B making it effective in detecting new cell tumors. However, besides these two causal agents, a person's genetic makeup could also serve as a platform for Formation of basal cell carcinoma. Such people suffer from a condition known as basal cell nervous syndrome. This is a rare situation which is characterized by symptoms such as characterize ordinogenetic tumors of the jaw, palmar or plantar, sole of the feet, paids, leafation of the flex carvery in the central line of the brain and rib abnormal ties. Now, how do you that you got BCC? Another common fracture may be a sign bump on the skin which appears purely or clear. It's often bright red or pink but could be black, tan a bone, especially if you are dark hair in this case. You may think it's a mole, but that could will be the mark of basal cell carcinoma. Finally, basal cell carcinoma may appear as a scar-like spot on the skin which may be red, may be white, yellow or waxy. However, this scar would have uneven edges and it would look shine and firm. This is as usual a serious sign that indicated that the cancer is within the skin. In spite of those signs or symptoms, the only way to actually know that you may be suffering from basal cell carcinoma is to undergo a skin bypass, the most common of which is the shape bypass, which is as usual done under local anesthesia. It's noted to know that most cases involving BCC can easily be diagnosed clinically nonetheless. On rare occasions, it might make further tests to indicate the presence of the cancer. As in all cancer cases, the most basic form of treatment is chemotherapy, and in the case of basal cell carcinoma, the inclusion of the chemotherapy agent 5-fluoric is known to be effective. Another topical agent that equally works well is Imuquid cream, a product that is reported to product a causes rate of 70 to 90% at reading and even entirely removing the cancer. Beside chemotherapy, curtain kits of surgery could also treat basal cell carcinoma. These are Mohs surgery and casualty with cashew liquid entering is used in freezing cancer cells, which result in their death. Whereas Mohs surgery involving the cutting away of the tumor and comparing it to a small cutout operation of normal looking skin around the tumor. In order to locate cancer cells, it should be noted that this type of surgery is most suitable for complex causes to BCC. A final option is immunotherapy, which is executed with the help of a common type of garden weed. Euporibi peoples. Alright, now let's do a quick recollection to the key points on BCC. The first thing we learned is that BCC is the most common type of skin cancer, but fortunately, you may not be a target of it, depending on your race and other factors. If you are white, then you stand a chance of acquiring it. If you spend too much time in the sun or get exposed to radiation or use curtain tanning products like thin beds, then you are also at risk. The second thing we learned in that BCC is generally non-fatal. That means you should not be think of death. Wait for more. It is not known to spread to other part of the body, but even if it does, it takes a much slower pace. Third point is that BCC could be cured with chemotherapy and surgery, of which MOS is the most effective kind for complex causes of the cancer. Thank you so much guys for watching this video.